Again, a good day to everyone and welcome to the second part of a three-series webinar titled Cervical Cancer Prevention, HPV-Related Cancer, and Vaccination. Before we start, I would like to give you some mental exercises. Presented to you on the screen are 9 different celebrities and VIPs from different generations. My question to you, what do you think is a common denominator among them? Aside from all being women and celebrities, what do you think is a common in all of them? Let us run them one by one. Evita Peron. I'm sure you know her from the song Don't Cry for Me, Argentina. Eva was an Argentine political figure, a powerful political leader, a first lady who fought for women's suffrage or the right to vote and helped improve the lives of the poor. English television personality Jade Goody. American actress from the TV hit series Miami Vice, Pam Grier. Scottish singer, songwriter, Sandy Thom. English actress and producer, Georgia Tennant. American actress and Broadway, Marisa Jarrett Binokur. American actress, Jessica Knowles. American TV personality, Erin Andrews. American actress and the cast of Saturday Night Live, Julia Sweeney. So what now do you think is common in all of these women? All of them develop cervical cancer. But what causes cervical cancer? Almost all cervical cancer cases are caused by HPV. But what then is HPV? Let me share you another test. What do you think is common in all these men and women? Let us know them first, one by one. Let me share you another test. What do you think is common in all these men and women? Let us know them first, one by one. Who can't recognize American actor producer Michael Douglas? Canadian American actress Pam Anderson and husband Motley Crue drummer Tommy Lee. English musician of Iron Maiden band Bruce Dickinson. Desperate Housewife star and actress Marcia Cross and husband Tom Mahoney. The daughter of Billy Joel, Alexa Ray Joel. An American TV personality, Brandy Glenville. And lastly, the beautiful star of Charlie's Angels actress Farrah Fawcett. What now do you think is common in all these celebrities? Yes, they all had HPV infection. Is that only it? Or could you think something more? Michael Douglas had throat cancer, whereas Pam Anderson and Tommy Lee developed genital infections. Bruce Dickinson had throat cancer. Marcia Cross developed anal cancer, while husband Tom Mahoney had throat cancer. Alexa Ray Joel developed genital infection. Brandy Glenville developed genital infection, while Farrah Fawcett died of anal cancer. So what else is common in all of them? All of them develop HPV-related cancer and diseases. So what is HPV? So what cancer can we get from HPV? The main thrust of this lecture is to inform you that not only women are affected by HPV, rather men too were recently found to be affected by HPV, and that it can happen to you, to your husband, and to your kids as well. So if they are right somewhere beside you, ask them to join in. HPV infection is the most common sexually transmitted infection in the world. Worldwide, it has been estimated that more than 80% of sexually active women and men will acquire at least one HPV infection by the time the age of 45 years old. So what is HPV? HPV stands for Human Papilloma Virus, which is a group of related viruses. In English layman's term, HPV is called warts. In Tagalog, it is called kulugo. Here is a question. Do you think kulugo found on your hands and feet is of the same type as that of kulugo that can be found in your genital area, such as in the penis, vulva, vagina, anal, or those found in the oral cavity or respiratory tract? HPV is a group of 150 types of viruses. Majority of the 150 types are harmless and can go away by itself. These harmless subtypes are the ones that you see on your hands and feet and body. But some subtypes, however, can cause genital warts, whereas some can cause cancer. There are 14 strains of HPV among the more than 150 strain that causes up to the 6 types of cancer. To give you more information in detail, HPV can be divided into two categories. One category can bring you harm and another harmless. Majority of the subtypes are the harmless, called cutaneous, which brings about common warts that you find in your hands, feet, face, and body. About 40 of the more than 150 subtypes of HPV are called mucosal or genital types, or the harm type. These types are further subdivided depending into your risk of developing cancer. One is the low risk, which means you have a lower chance of developing cancer, whereas the high risk, you have a higher chance in developing cancer. There are about 13 to 15 HPV high risk subtype published, but for convenience, let's stick to 14. Low risk, as the name implies, has a low malignant potential, meaning low chances of getting the cancer. However, most subtypes belonging to this group causes genital warts that can be found in the scrotum, penis, anus, vulva, vagina, and oral and throat areas. Genital warts appear in various sizes and shapes. Some people get a few warts, while others get many warts. The most common sign of these warts are small scattered bumps and skin colored or a bit darker. A cluster of bumps that look like cauliflower. Or growth in the genital area that can be raised or flat and smooth or rough. In the next section, please find images of genital warts. Shown to you are the 40 subtypes belonging to the low HPV that frequently causes genital warts. More than 90% of these genital warts are caused by two types, HPV 6 and HPV 11. Unlike the low risk type of HPV, the high risk type does not cause any symptoms or warts. Unlike the low risk types of HPV, high risk type does not cause any symptoms and warts. And because they have no symptoms, they are left untreated and last for a long time within the body to cause changes and abnormalities in the cells that later develop into cancer. In male, HPV causes penile cancer, oral, throat, and anal cancer. In female, HPV causes cervical cancer, vaginal and vulvar, oral, throat, and anal cancer. HPV is responsible in almost all cervical cancer cases, about 40% of vaginal and vulvar cancer, 90% of all genital warts in both males and females, 25 to 35% of mouth and throat cancer in both sexes, 40 to 50% of penile cancer in men, and lastly, 80 to 90% of anal cancer in both sexes is caused by HPV. Shown to you are 14 high-risk types of HPV. Among these 14 subtypes, type 16 and type 18 are the most common high-risk type that causes cervical cancer. How does HPV get transmitted? The most common route to spread of the HPV is through intimate skin-to-skin contact, typically during sex, and not just vaginal sex. It can be spread via oral sex, anal sex, or digital sex. HPV transmission are not just limited to the union of the male and the female. Transmission can also occur between men, or what you call as MSM, or men who have sex with men, or WSW, or women who have sex with women. Another mode of transmission, though less common, is through an infected birth canal. Mothers who have cervical HPV infection or even cervical cancer can transmit the disease during vaginal delivery. Here is an example of a mother who had cervical cancer and delivered per vagina her two boys. Her kids later were found to have lung cancer of cervical tissue cells in origin. The doctor said the mother's malignant cells were breathed in during the delivery. And lastly, through a very rare form of transmission is through fomites. Fomites are the transmission of HPV left on objects such as sex toys. Ways HPV cannot be spread, according to the American Cancer Society. HPV cannot be spread through hugging, holding of hands, toilet seats, swimming pools, hot tubs, and the sharing of utensils. What are the symptoms of patients with HPV? Majority of patients do not even know why they have HPV infection because there is zero symptoms. Because there is no symptoms, it's hard for you to know if you or your partner is infected. The only symptom that points out if you have an HPV infection is when you develop genital warts. Majority of genital warts are caused by low-risk HPV. The high-risk HPV does not provide symptoms or asymptomatic. Can HPV be passed on even when an infected partner has no signs and symptoms? The answer is yes. HPV can be passed even when an infected person has no signs or symptoms. How do you detect HPV? HPV can be hard to detect because majority of these cases are without symptoms or asymptomatic. One way to detect HPV is by checking for genital warts around the vulva, vagina, and anus in women, or around the penis, scrotum, and anus in men. In women, HPV can be detected in the cervix using a HPV DNA test or a pap smear. Anal HPV can be detected in both male and female using a pap test, but this is still considered experimental at this time. So who is at risk of developing HPV? The risk factors include number of sexual partners. The more the sexual partners you have, the more likely you are to contact a genital HPV infection. Having sex with a partner who has multiple sexual partners also increases your risk. Age. Genital warts occur most often in adolescent and young adults. Weakened immune system. People who have weak immune system are at a greater risk of HPV infection. Immune system can be weakened by HIV or AIDS or by immune system suppressing drug used after oral transplantation. Damaged skin and personal contact reflects mostly to common warts. How can I prevent HPV infection? Prevention can be attained using the acronym ABCDV, where A stands for abstinence, B stands for be faithful, C stands for condom use in case of emergency, D is for doctor's consultation should you need one, and lastly V for vaccination. Let us now go to HPV vaccine and vaccination.
HPV stands for human papillomavirus. It is the most common sexually transmitted infection in the world. It is spread through sexual contact with someone who has the virus. About 75% of Canadians will get HPV at some point during their lifetime. Most infections clear on their own, but others do not. HPV infections that do not go away can cause at least 6 types of cancer. There are vaccines available to help prevent HPV cancers in both boys and girls. HPV vaccination is safe and effective. The Canadian Cancer Society recommends the vaccine for boys and girls. It is most effective if given to boys and girls at the recommended age of 9 to 15 before they are sexually active and potentially exposed to HPV. At this age, children also have a better immune response to the vaccine. The HPV vaccination works by stimulating the body to produce antibodies that, if exposed to HPV, bind to the virus and prevent it from infecting cells. HPV vaccines have been approved for use in over 100 countries, and more than 100 million doses have been distributed worldwide. They have been tested extensively, and benefits are consistently shown to outweigh any potential risks. The most common side effects of the vaccine include swelling, redness and soreness at the injection site, fever, headache, and fainting. Helping prevent cancer starts at an early age. HPV vaccination is something you can do now to help protect your child from cancer for years to come. Talk to your doctor or healthcare provider to learn more about the HPV vaccine and to find out if the vaccine is right for your child.
Who is HPV vaccine recommended for? HPV vaccine is best recommended to male and females between the ages of 9 and 14 years old. The vaccine is ideally given to grade 6 students routinely in developed countries between the ages of 11 and 12 years old for 2 doses. In the Philippines, free vaccines are given to 300,000 students divided into the 20 poorest provinces. We are starting to give it at grade 4, that is about 9 years old, because it is presumed that this is the age when you could start your first sexual contact. Recall that we have problems on teenage pregnancy. Imagine 495 live births every day from women aged 10 to 19 years old. I found this on Rappler dated 2015 in reply to the vaccine rollout by the Department of Health that reads, "My concern is that nag-uumpisa pa lang tayong mag-usapan ito, pero iro-roll out na ng Department of Health," referring to the immunization program. I thought this may be a good opportunity for the Inner Wheel members to carry on to provide informed discussions in your communities, and that it helps to promote your brand. Like, whenever you say polio, you think about Rotary. Whenever I think of cervical cancer, beginning today, I will think of the Inner Wheel Club of the Philippines. But who knows? It could be absorbed by the international inner wheel someday. Now, HPV vaccine are recommended too to late adolescent children and young adults aged 15 and 26 years old. At this age, you need 3 doses instead of 2. What about for ages beyond 26 years old? Vaccination between the age of 27 and 45 is a shared clinical decision. This means recommendation is not for everyone in default. Shared clinical decisions depends mainly on patients' characteristics, values, and preferences, guided by the best available evidence of who may benefit from vaccination, and likewise your healthcare provider's clinical discretion. Some reasons why routinely it is not recommended at this age is because vaccine effectiveness is lower in older age groups because of prior infections, and that of lower risk of exposure, like for example, among persons who are in long-term, mutually monogamous sexual partnership. However, if you might be at risk from acquiring a new HPV infection in the future, like having plans to have sex with a new partner in the future, then you might benefit from this vaccination. What about for ages beyond 45 years old? HPV vaccines is no longer recommended to women aged beyond 45 years old. Experts feel that by the time you reach age 45, you may have acquired majority of the HPV strain and that your risk of exposure is low. Shown to you are the 14 strains of HPV that can cause cervical cancer. Now, we have three types of vaccine out in the market: the HPV-2, HPV-4, and the HPV-9. Shown to you are three of the HPV vaccines on tabular form. HPV-2 protects you from 2 of the 14 HPV types that causes cervical cancer. It is only given to females up to age 26 and offers 70% protection. HPV-4 is similar to HPV-2. However, they added 2 additional HPV type that causes genital warts, which are type 6 and type 11. Hence, it protects you not only from cervical cancer, but from getting genital warts. Due to this, it can be recommended to boys. HPV-9 is the latest vaccine that has some similarities with HPV-4. 5 subtypes of HPV causing cancer was added to the vaccine, which can now protect women up to 90% from getting cervical cancer. Another thing is that it can be given at any age. Now, vaccine dosing depends upon the age. All patients 9 to 14 years old only require 2 doses, whereas for age 15 and above, 3 doses is required. The frequency of vaccine depends on the brand. Generally, for children aged below 15, the dosing schedule is 0 and 5 to 13 months for the second shot. For those above or equal to 15 years of age, which require 3 doses, the schedule is generally 0, then 2 months after the first shot, then 6 months after the first shot. Please watch this video on the safety profile of HPV vaccines.
It's projected that if we vaccinated 80% of the 12-year-old girls across the globe today, we would save 420,000 lives from cervical cancer. There's no scientific evidence between the stories that are circulating in Ireland and the science and the evidence that we have at our disposal today. And that's what parents need to understand. They need to make sure that they make an informed choice, and they need to understand that the choice they make today will impact the lives of their children, their girls, tomorrow and in the future. Please look for reliable, trustworthy sources of information when you make this decision. The only qualified website, for example, in this country is the Ministry of Health's website, is immunisation.ie. I would urge parents to consult their GPs, to visit their local health facilities if they have concerns, ask the questions that they need to ask, and make sure they make an informed decision. This is a terrific vaccine. It has an excellent safety profile. And we are now sure, given the evidence that we have from different countries, including Scotland most recently, that the vaccine works. So we are very confident that this is the best option that any parent or any child has today to avert and avoid cervical cancer and other HPV-related cancers in the future. And that should never be underestimated.
We go now to answers to frequently asked questions on HPV vaccine. How long does the vaccine protection last? Will a booster shot be needed? The length of immunity is usually not known when a vaccine is first introduced. So far, studies have shown people to be protected after 15 years since the vaccine was first introduced in 2006. Furthermore, a new study on HPV vaccine concluded that the vaccine has not only resulted in a dramatic decline in human papillomavirus infections, but evidence shows it is also effective in reducing cervical precancer lesions that can become cervical cancer. More research is being done to find out how long protection will last and if a booster dose will eventually be needed someday. Can an HPV vaccine series begun with HPV 2 or HPV 4 be completed with HPV 9? The answer is yes. Any HPV vaccine may be used to continue or complete the series. Does CDC recommend revaccination with HPV 9 for people who previously received a series of HPV 2 or HPV 4? CDC has not recommended routine revaccination with HPV 9 for persons who have completed a series of another HPV vaccine. There are clinical data that indicate revaccination with HPV 9 is safe. Who should not receive HPV vaccine? Anyone who has ever had a life-threatening allergic reaction to a component of HPV vaccine, such as Baker's yeast, or to a previous dose of HPV vaccine should not get the vaccine. Pregnant women should not get the vaccine, although the vaccine appears to be safe for both the women and the developing baby. Mothers can receive their vaccination after pregnancy. Breastfeeding women can safely get the vaccine. And lastly, people who have a moderate or severe acute illness should wait until their condition improves to be vaccinated. This ends my presentation and thank you for listening.